Is that pretty cool? I know I'm getting excited over here. I wanted to show you something else. Go back to this whole thing about calcium channel blockers. Calcium channel blockers. Remember, I said that calcium, going back to this, calcium is used for depolarization in the atria and depolarization in the, what's the other place? Deep, okay. Ooh, I love it. Calcium is used for depolarization of the atrium and depolarization of the thalamus. Sodium is used for depolarization pretty much everywhere else. However, calcium is the one that's used for contraction of all muscles. So, calcium, watch this. Calcium, I did it in pink, right? So, calcium is used for, we said that calcium is used for depolarization of the atrium or atria and the thalamus. But calcium is used for contraction of all muscles. There are three types of muscles. You have skeletal muscle, you have cardiac muscle, you have smooth muscle. All of those are muscles and they all need calcium to contract. Okay? So calcium is used for depolarization. Calcium is used for contraction. Calcium is also used for cell signaling to involve things like neurotransmitters, to involve things like hormones. Okay? Calcium is used for movement. In fact, if anything in your whole body moves, we have to have three things. Anytime anything moves, we need three things. One of them is calcium. Another is ATP. Another is microtubules. This is what my mentor was able to show me and how he told me, go back and learn normal for yourself. Medical school didn't teach me all of this. I mean, we learned bits and pieces, but nobody put the story together like my mentor, Dr. Francis. So I owe so much to him. And now I'm honored to be able to teach this same kind of thing to other people. Calcium. We said that calcium is used for depolarization in the atria and the thalamus. If we have too much depolarization, that's going to cause a fast heartbeat in the atria. It's going to cause seizures in the thalamus. In the gut, it's going to cause so for instance, in the smooth muscle of the gut, it could cause things like diarrhea. In the skeletal muscle of the arms and legs, it could cause cramps. Okay? So, let's go back to this calcium channel blocker situation. Here's our cell, and we have this calcium channel that allows calcium to go into the cell. If I give somebody a calcium channel blocker, what kinds of side effects would I have? Now, what kind of calcium channel blockers do people use in EMS? Bootcamp, type that in the chat for me. Calcium channel blockers in EMS. Give me some examples. All right, let me help you out. So in EMS, some calcium channel blockers that we use are things like nifedipine, nicardipine. Okay. Sometimes we use things like amlodipine. Oh, actually, amlodipine needs to be here. Amlodipine. Okay. Then we also have other calcium channel blockers that are diltiazem. So that's things like also called cardizem, verapamil. Okay, now how do we classify these kinds of calcium channel blockers? This first section, these are what are called, these primarily work on vessels. So these are what are called vasoselective. And these other ones down here are what are called cardioselective. Okay, so the cardioselective primarily work on the heart, and the vasoselective primarily work on the vessels. There's another fancy word that we use to describe these. The vasoselective ones are called dihydropyridine. And then, so dihydropyridines, and then the cardioselective ones are called non-dihydropyridines. Okay? So those are calcium channel blockers. Now, have you ever been told the side effects of nifedipine, nicardipine, amlodipine, diltiazem, cardizem, verapamil? Have you ever read that? Oh boy, we're in trouble. So you're about to give this patient right now. We got a patient in AFib, A-flutter. We need a calcium channel blocker on board quickly. We need to explain to this patient right now, hey, ma'am, sir, I'm about to give you this drug. Oh, by the way, it's probably going to cause some side effects. These side effects are about this many 500. Do you want me to give it? Are you okay with it? Now, we should always give patients, we should always explain to patients the risk versus benefits of any medication. We never give a medication, or you should never give a medication that you don't understand. Because once that medicine is in their body, we may not be able to do anything for it. Or it may just have to kind of run its course until it's metabolized, right? We may be able to try to neutralize some of the effects, but once it's in there, it's in there. It's got to be processed. So, could you right now on the spot give me? I need like 100 side effects right now, and you don't have time to go read all this stuff. Because, I mean, that's going to take you about 500 articles to know all this. Okay. For me, it took me about $300,000 to find out all this information. But what if we could, based on what I told you so far, could you figure out the side effects of all these calcium channel blockers right now? You want to try? Let's go. You ready? All right. We got to come up with we got all these calcium channel blockers. I need you to right now give me all these side effects. Well, here, all we got to do is figure out, where does calcium normally go? If I block where it normally goes, it's not going to have that effect. So watch this. Let's go. Let's go into the let's go into the atria. If I block it going to the atria, what's it going to do? Watch this. Here's the heart, right? If I block the cells, remember in the atria, we've got the SA node, we got the AV node, and then we got all this musculature. We got all this muscle stuff going on in the atria too. If I block the SA node, what effect is that going to have? If the SA node is the primary pacemaker responsible for setting the heart rate, and if I block the SA node, what effect is it going to have on heart rate? It's going to go down. So we may cause bradycardia. If I block the AV node, same kind of thing. In fact, those would be contraindications for most calcium channel blockers. If they already have a problem with their SA node, i.e., sick sinus syndrome, if they already have a problem with their AV node, we probably don't need to use this calcium channel blocker because we may make that problem worse. But I didn't have to read that. I just know how the cell works. Okay. Now, if I block the cells up here in the atria that are depolarized in the atria, yes, overall, it's still going to have a slower heart rate. But remember, the cells of the atria, or the atria itself, when they depolarize, then the atria contract. And when the atria contracts, it dumps blood from the atria down into the ventricles. So if I block it, now I can't get as much blood down into the ventricles. What's that called? That's decreased preload. So I already know it's going to cause bradycardia. It can cause decreased preload. Wow. Okay. What about in muscles? Okay, if I block my skeletal muscles and they can't contract, how am I going to feel if my muscles don't contract? Am I going to be all energetic, or am I going to be slow and sluggish? So if I give this calcium channel blocker, it blocks my muscles. Now I'm sluggish. I can't move. If I can't move and I'm sluggish, am I tired or full of energy? Do I move fast or slow? Okay. Do I think fast or slow? Okay. Okay. Do I have muscles in my neck? Yeah, we've got accessory muscles that help us breathe. Remember the scalene, sternocleidomastoid, things like that, right? We've got the trapezius back there, back in the back. So if these muscles are not really contracting well, can I hold my head up, or is my head going to be down? Up or down? if the muscles don't work. It's going to be down. Wait a minute. What did I just describe? Picture this person. I've got a person who's slumped over. They can't move. Their head is down. Wait, are there muscles in the mouth? Oh, wait, I've got all kind of muscles in the face. They can't really smile because I need my muscles to contract for me to smile. So I got a mean face. My head's down. I'm tired. I don't want to move. I'm weak. What patient am I describing right now? Who fits all of that? Who's somebody that's tired all the time? They don't want to move. They're weak. They're drowsy. They have a sour looking face. Huh, does that sound like depression? Huh. Wait a minute. Are you telling me, coach, that a calcium channel blocker could cause depression? That's exactly what I'm saying. Now, how many of you have told your patients that, oh, well, when I give you this calcium channel blocker, hey, it's likely to cause depression? Well, if you've never understood the cell, you may not have made that connection. A lot of books are not even going to mention that as a side effect. Now, if you'll look heavily or if you'll look more deeply in more research articles, you'll find you don't have to take my word for it, just Google it. Can calcium channel blockers cause depression? Your answer is going to be a resounding yes. But see, I'm able to figure this out just based on the normal physiology of the cell. Is that not pretty cool? Now, but just knowing how it works, watch this. Okay. We said that in skeletal muscle, okay, the muscles don't move. Now I'm going to be tired. I can't move. All of that. Cardiac muscle. It's not, for instance, the SA node gets affected, the AV node gets affected. This is why if they have diseases or disorders of their SA node, like sick sinus syndrome, or if they have some kind of AV nodal problem, maybe if they already have a heart block, I don't want to be given a calcium channel blocker because I can make that heart block worse. They already have first degree block. They already have second degree type 1 winky block. They already have second degree type 2. They already have a third degree AV block. I need to be very careful using calcium channel blocker. I may need to not use it at all. Now, what if in the smooth muscle? Oh, wait, where do we have smooth muscle? Watch this. Look how much we can figure out by knowing the basics. Oh, wait, we got smooth muscle in the GI tract. We got smooth muscle. So there's smooth muscle in the uterus. There's smooth muscle in the bladder. Wait a minute. Where else is there smooth muscle? Wait, there's smooth muscle around blood vessels. Where is there smooth muscle? Oh, there's smooth muscle in the respiratory tract. Huh. Wait a minute. Let's take each one of them. If I can't contract the muscles surrounding the smooth muscle surrounding the colon, that means that I can't really move my colon. If I can't move my colon, stuff stays in the colon. Is that going to lead to diarrhea or constipation? Wow. So a calcium channel blocker can cause constipation. In the uterus, I need the uterus to contract. Okay, if I have a pregnant mom who just gave birth, I need that uterus to contract so that I can release oxytocin, cause uterine contraction to prevent postpartum hemorrhaging. Huh, what if they're already taking a calcium channel blocker and they go into labor? Could it affect their uterus being able to contract? And if it cannot contract, could they potentially bleed to death? Huh, wow. What about the bladder? Wait a minute. Okay, is there smooth muscle in the bladder? Absolutely. In fact, that bladder is actually the muscle there is called the detrusor muscle. When the detrusor muscle here, this is what it looks like. It's like this. So we got the bladder, and then coming from the bladder, we've got the urethra, and then you're going to pee it out, right? Okay, and then coming to the bladder, we've got these ureters, and then that's going to come from the kidneys, right? Okay, now, so when this detrusor muscle, so we have this muscle right here, this detrusor muscle of the bladder, when it contracts, that's what allows you to pee. So in order to pee, the detrusor muscle has to contract, and then internal urethral sphincter has to relax. That's what when this thing squeezes and then we push urine out, this guy right here has to relax and then the urine comes out. But what if I give him a calcium channel blocker and I cannot contract this bad boy? What's going to happen? If I'm not able to contract the detrusor muscle, what happens to my urine? Because when it contracts, that's what helps me pee. If it cannot contract, what's going to happen? Now I'm, oh, so what will we call that? Oh, that sounds like urine retention. Huh, that sounds like urinary retention. Wait, you're saying a calcium channel blocker could cause urinary retention? Absolutely. Okay. Oh, what about the respiratory tract? There's smooth muscle. All right, check this out. Okay, let's go to the respiratory. So we've got our trachea with our cartilaginous rings here. We've got our left and right main stem bronchus that meet in the at the carina, and then these are going to come into smaller bronchioles, and then we're going to get to those terminal bronchioles. Then we get to our alveoli. Now, but there's also smooth muscle surrounding this respiratory tract. What if this smooth muscle doesn't really contract? But part of when it contracts, that's what helps us move mucus out of our respiratory tract. Well, I need it to contract to move the mucus. If I block it with a calcium channel blocker, now that muscle doesn't contract. What happens to the mucus? Ooh, wait a minute. So the mucus is going to stay. So, am I more likely to have infections or less likely to have infections if I have something trapped in there? Ooh, so I'm now more likely to have respiratory infections because I gave a calcium channel blocker. Okay. Is this pretty cool? Okay. So let me show you what. Oh, let me go to this other thing about cell signaling. Did that show up? Yeah, cell signaling. Now, in order for, let's say, things like in the pancreas, in the pancreas, we've got here, let me clear some space. In the pancreas, we're almost done. Don't confuse this with the liver. This is the pancreas. We have this cluster of cells in here, the pancreatic islets. There are three types of cells in here. We have alpha cells, we have beta cells, and we have delta cells. We have delta cells. Okay. Alpha cells are what produce glucagon. Beta cells are what produce insulin. Delta cells are what produce somatostatin. So these are all hormones. In order for the pancreas to release insulin, I must have calcium. If I give a calcium channel blocker, now the pancreas cannot secrete insulin into the bloodstream. If I cannot secrete insulin into the bloodstream, what's going to happen to the blood sugar? Because the job of insulin is to make the blood sugar level come down. But if I don't have any insulin in the bloodstream, what's going to happen to the blood sugar? It's going to increase. So now we can have increased blood glucose level, also known as hyperglycemia. So let me show you what a calcium channel blocker can do. A calcium channel blocker can affect the SA node. It can affect the AV node. That's going to affect heart rate. We don't want to give it it would be contraindicated if they already have problems with those. It can definitely slow down heart rate. It can affect all muscle contraction. It can affect movement in all muscles. It can affect in the GI tract. It can cause constipation. It can affect the uterus. In the bladder, it can cause urinary retention. In the blood vessels, if those muscles don't contract, then the muscles relax surrounding the blood vessel. Now it's going to lead to vasodilation. If I vasodilate, now I can have, what's that going to do to my blood pressure if I widen the blood vessel? Is the blood pressure going to go up or down if the pipe gets bigger? Aha, so now I can cause hypotension. Okay, if I can't contract the smooth muscle around the respiratory tract, now I'm more likely to have respiratory infections. Look how many things. Oh, and we also mentioned when it comes to hormones like insulin, we mentioned things like it could also cause hyperglycemia. You have never read probably half of this stuff, but look how much we were able. Now, obviously, it took me a minute to explain everything, but imagine if you were to practice doing this on a regular basis, how much you would know just by knowing the cell. Now, what did you learn today? That was a lot. So we're ending now, but what did you learn today?